again, friends and colleagues in the media, for being here today at the City County Health Department in Peoria, Illinois. I want to thank you for your continued support of this campaign you have engaged in cooperatively to keep our community informed about the epidemic. I'm happy to report after being gone for a couple of days following Mayor Artis on Monday, it is still all systems go in central Illinois. The emergency operations plans, their various command centers and incident command structures continue to dig in and make plans for the event. And it's clearly not here yet, but we're preparing for it and we're ready for it. All systems are go. All public safety systems are prepared and ready to respond. The major medical and healthcare systems in our region are all ready to do their part, and we are prepared. And I want you to take confidence in the fact that you live in a community with extraordinary resources, both in the public and private sectors, and some really smart people involved in planning, not to mention our own epidemiologist, the director for the health department, who will be up next, Monica Hendrickson. I'd like to talk to you just for a minute about a couple of simple things, but I think it's really important that since sheltering in place has become the pastime for many of us. It's a new thing. It's not something that we're used to. It's certainly something we never would have expected to happen. But there's some things I think with sheltering in place you have to remember. We're not attempting to put upon anybody this order. What we're doing is trying to stop the spread of disease, and in particularly a pretty aggressive virus. But let's remember to, in our neighborhoods, be sure we check on those of us who are perhaps older or infirm from various medical conditions or disabled in some way. Let's make sure that our neighbors and friends have all of the things that they need, and whether it's through your neighborhood organization or your church or civic organization, let's make sure that everyone who is sheltering in place is taken care of. And if you need help with that, call 211. Let me remind you also, if you are feeling unwell, to call your doctor. If you are feeling unwell and you call your doctor, they have now expanded both with the OSF healthcare system and the Unity Point Health system, comprehensive triage systems, advice lines, and new technologies that whether they're going to talk to you face-to-face or you could use Claire, for example, with OSF system. There are lots of interactive ways by phone or using the internet to get advice on what to do if you're feeling unwell. If you don't have a doctor and don't have a health system necessarily that you're associated with, a lot of people don't, please call 211 or 1-309-999-4029, and 211 will help connect you with Heartland Clinic and we'll find you a doctor. Okay, you don't have to go to the ER, you don't have to call 911 unless you're really, really sick and it's an emergency. 211 and we can get you access to OSF, Methodist, or Heartland Community Health Clinic. Finally, on behalf of the Mayor, Chairman Zimmerman, and Chairman Krug from Woodford County, I'd like to thank everyone who has helped make the last several days of sheltering in place much, much easier for your local governments, and I appreciate everyone lifting their eyes and ears to check on their neighbors. I'll invite Monica Hendrickson up for her report. Thank you.
Thank you, Chairman Rand. Good afternoon. To begin with, the to-date count for the Tri-County region continues to be at 8 confirmed positive cases, 66 negative cases, and 31 pending cases. Again, that is 8 confirmed cases in the Tri-County, 66 negative cases, and 31 pending cases. There are now 32 out of 102 counties in Illinois reporting cases, including Marshall County, just to the north of us. It is important to understand that the stay-at-home or shelter-in-place executive order is an intervention being used to decrease the speed and transmission of the COVID-19 in our communities, especially as we lack vaccines or medications at this time. And with that, there is a lot of information out there around medications or possible other remedies to help you get through this virus. Make sure you're utilizing reliable sources. The Centers for Disease Control and Prevention, or the CDC website, the Illinois Department of Public Health website, and a medical healthcare provider to get information about how you can control and decrease your symptoms and the issues related to COVID-19. As mentioned, the stay-at-home or executive order of sheltering in place is an intervention, and with any intervention, it can only be as effective as the effort made to comply with it. So thank you to our community partners and our residents for being willing and active members to comply and give a good effort in this. We will not necessarily know the impact of how this will affect the curve, so to speak, for the next days and weeks to come. But that should not be a reason why we should not follow the governor's executive order. This is a community response, and as a community, we need to work together in ensuring the health and safety of all of us. To further discuss safety, especially in regards to domestic violence, I would like to introduce Carol Myrna, the CEO of the Center for Prevention of Abuse.
Good afternoon, everybody. I want to say thank you to those who are leading the operation at the EOC. Your work is important, and I appreciate the invitation. Truth be told, I was feeling a sense of urgency about providing information on the essential services of the Center for Prevention of Abuse, so I really appreciate the opportunity to be here today. Let me also offer a few words of heartfelt gratitude to the caregivers, not just the champion doctors and nurses and first responders, but also the counselors and the caseworkers and the social workers and the therapists who are doing their level best to help everyone and provide safety, hope, and healing. Our mission at the Center for Prevention of Abuse is to help all people live free from violence and abuse. We do so through free and confidential services, emergency shelter, counseling, therapy, casework, medical and legal advocacy, and so much more. The Center for Prevention of Abuse is carefully mitigating COVID-19 and taking precautions to keep our staff, our clients, and those who come in contact with our agency safe and healthy. Many businesses are suspending operations, schools are moving to remote learning, people are advised to distance themselves and to stay home, all in order to keep themselves safe and prevent the transmission of the virus. Yet there remains a population of Americans who are not safe in their homes. It's victims of domestic violence. In circumstances such as the one where we find ourselves right now, victims may in fact be quarantined with their abuser. We know that during times of crisis, including epidemics, the risk of gender-based violence increases, and so does the need for social services and specialized care. The Center for Prevention of Abuse provides essential human services, and it's crucial that we continue to offer our free and confidential care for survivors in Central Illinois who need our help. We truly do not want to see anyone having to choose between their safety and their health. Frankly, abusers can use this time to exploit isolation and social distancing that's currently recommended. Abusers may use these circumstances in order to elevate and enhance their power and gain more control within a relationship. The threats, the confinement, withholding of resources including medicine and finances, the violence or the risk of violence can exponentially increase and create an even more unsafe and dangerous environment. Victims are simply sheltering where they're told, at home as instructed, but it could become the most unsafe place of all. I want to update you on the Center for Prevention of Abuse services and procedures. Our crisis hotline remains staffed 24 hours a day to take calls from individuals who are in danger or in need of safe shelter or crisis intervention. That number is 1-800-559-SAFE. We continue to provide assistance with safe shelter through our Peoria main campus location, while we have temporarily closed our Pekin shelter. Everyone receives virus screenings before entry. We continue to provide assistance with orders of protection that are now initiated over the phone. Individuals in need of filing are encouraged to call our order of protection offices in Peoria, Tazewell, and Woodford counties. Individuals who are in immediate danger should always call 911 or their local law enforcement. We are providing high-quality therapy, counseling, and casework, but now through our telehealth model, continuing to stay connected with our clients and their healing process. While we navigate this unprecedented time, the Center for Prevention of Abuse is devoted to providing services and helping vulnerable populations of survivors of abuse and violence. Please visit centerforpreventionofabuse.org to repeat this information and for all the phone numbers. Thank you.
Thank you, Carol, and thank you, your team, for what they do for our community. Today also marks over a week of school closures for Illinois, and to provide a situational report is the Peoria County Superintendent, Beth Kreider.
Good afternoon. I am so thrilled to tell you that in the 4 days we had no school and were sheltering in place last week, we served over 15,000 meals in Peoria County. And that is something. That's children getting their needs met, even in a situation that is hard for all of us. Some updates about that I'd like to share, however. In Peoria Public Schools in particular, they are moving to a change where you will get multiple meals in one delivery. So instead of picking up a meal every day, they're moving to a Monday, Wednesday, Friday operation, and you get multiple meals in one delivery. We're trying to reduce our exposure, reduce the amount of time that people are needing to come out and pick up those meals. So all of that information can be found on their website. Also, we know that there are some special situations that require a one-on-one delivery. Thanks to an incredible corporation here in Peoria, we have a system of logistics that can get a one-to-one delivery to you and your family if you need it. You can contact MassCare Peoria County IL at gmail.com to get more information about that, and a meal can be delivered to your door. One last thing I'd like to share is the governor announced the school closing is going to be longer than March 30th. We're going to go all the way through April 7th. The Illinois State Board of Education is currently working on guidelines of what those days will mean and what those days will require. Your school superintendents in Peoria County are currently working on a plan and waiting for those guidelines from the state board so that we're ready to keep your children engaged even while they are at home at this time. And with that, I think that's the last update that I have. Just thank you to those schools, those volunteers, the school lunch ladies, the true heroes that are making sure our children are getting their needs met. Thank you.
Thank you, Beth. As this operation continues to go on, one of the key individuals that's involved in this are our EMS providers. And with that, I'd like to introduce Dr. Jackson to discuss our EMS services.
Thank you, Director. My name is Matthew Jackson. I'm the EMS Medical Director for Peoria Area EMS. I also oversee pre-hospital care and EMS for OSF Healthcare. To give you sort of a brief scope of what our EMS system entails, we cover 75 provider agencies, nearly 2,000 providers in the Peoria area alone in a 7-county radius. We provide the medical authority over EMS and including our 911 dispatch. I kind of wanted to go over with you today some of our EMS response to the COVID-19 crisis, one of which being the dispatch measures. We have taken this to the level of letting our dispatchers ask a few simple questions to do some pre-screening prior to arrival of EMS crews. That way we can make sure that we are dispatching the appropriate crews at the right time and to the right patient. Obviously, we want to have a very safe approach for our providers to make sure that they have good situational awareness when they get into a potential case, and that way we know to prepare. It would take very, very little mistake to put down an entire crew into quarantine, so we need to have a measured response to these cases. From that standpoint, when 911 is called and our EMS providers do arrive on scene, they're instructed to do what we call a from-the-door assessment. So when they first make contact, they're maintaining that distancing. We were talking about social distancing. This also applies to our medical providers as well initially. Once they make contact, they're going to be asking a few more questions to determine if there is a risk. Once they figure out that there is a risk, then they will be putting on appropriate protective equipment. When they put on the appropriate protective equipment, they will be limiting providers in the patient's sphere in order to do a proper assessment, and everyone else is being kept outside unless absolutely needed. We are limiting some of our EMS response currently. At some points, you may actually have one provider vehicle arrive on scene, and the ambulance may either be delayed or withheld depending on the circumstance, but you will get a provider at your home or location if you do call 911. But don't be surprised if you have just one provider show up to do the initial triage and screening. I also urge people that most situations associated with this illness are mild to moderate and can be managed from home. Most situations do not require a 911 dispatch. There are a lot of other creative solutions that have been mentioned previously that patients can utilize in order to figure out where they need to go and to get the appropriate help. One of them is the Claire Assistant chatbot, which can actually be accessed on the OSF Healthcare homepage. The other one would be the COVID-19 Nurse Hotline, which can be reached at 1-833-OSF No, KNOW, or 833-673-5669.
Could you repeat those just a little slowly?
Absolutely. So the COVID-19 Nurse Hotline is 833-673-5669.
Thank you.
Thank you. So I urge people to understand the perception of this and how we are responding to an emergency at this situation. Obviously, we are expecting an increase in call volumes, and we would urge people that if you are not having an emergency, if you are having symptoms, to try one of these other alternative routes first prior to calling 911. And or obviously, if you're having an emergency, we have crews and we have a response plan in place, and we will get crews to deliver timely care to you. We are continually monitoring this situation as an EMS system. We are also in collaboration amongst all the entities in the area, including the two healthcare systems within Peoria. We take a lot of direction from Illinois Department of Public Health, in addition to the Centers for Disease Control, and also we're in close contact with the local health department emergency operations center, and we are providing interagency cooperation and sharing of policies and information across all of our system agencies. Thank you.
Thank you, Dr. Jackson. With that, we'll open it up for questions from the group.
Yeah, so one thing the governor said today, Monica, was he talked a lot about medical capacity and hospital capacity, and he talked about a lot of hospitals setting up mobile tents to prepare for increased number of people in the hospital. Can you talk about what's being done locally here to prepare for increased capacity?
Definitely. So the question is, in terms of increased capacity, especially in our healthcare systems, what is that planning that's involved here locally? Our region is really advantageous. I think Chairman Rand really touched on in the fact that we have an amazing amount of resources, two large healthcare systems, Union Point Health as well as OSF St. Francis Medical Center, both of which support a region as a whole, not just Peoria County, but our surrounding neighbors. And so we've actually routinely met with executive leaderships to talk about surge capacity. Many of us receive grant funding throughout the years from the Illinois Department of Public Health to support grant deliverables and planning for various activities, one of which the hospitals and your local health departments receive funding on is planning on surge capacity. So in essence, they're really looking at the plans that they have worked on as well as trained on for years and understanding kind of what they need to do for a larger regional approach. Now, these plans don't mean that we're going to get it right off the bat, but it's a starting ground for us to work off of and understand the different nuances that might come into play. Some of the plans considerations have kind of changed over time. One was PPE supply or personal protective equipment supply. What does that mean now for our surge capacity? As well as understanding that, previously we had exercises where we could bring in maybe outside nursing from different communities. That may not apply in this response. So really looking at those plans and then updating it with the current understanding of what's going on with COVID-19.
So in terms of space, I know Hopedale Medical Complex set up a tent. Is there any plans to do that elsewhere, or is that even in the works at all?
The large hospital systems here locally feel that they are able to with their current facility structures. Now, granted, it's not just their two hospitals, but they actually have smaller facilities as well as their outpatient points of care too. I think a lot of the tent capacities that you see are really in more of our rural communities to help kind of control and create those different isolation points for triaging purposes.
And then I know the mayor last week on that issue, he mentioned the hotels potentially, Marriott downtown. I mean, is that a discussion at all in an emergency situation?
I think we've seen it now, the idea of hotels in terms of housing and what they can play a role with. We saw that the city of Chicago has actually went forward with some housing in hotels. San Francisco is another community that's been using housing. It is a model that from the Federal Emergency Management Agency or FEMA, as well as locally, that they are asking jurisdictions to start planning for different modeling for different housing types. That includes individuals that may not be able to go back to their home setting because just of space restrictions, whether or not they're symptomatic. Others that live in a congregate living setting, such as our shelters, they may not be able to go back to that shelter after being discharged from a hospital. And so we are planning as a tri-county different housing models, recognizing the fact that as this progresses, that we're going to have to find different alternative housing for the different needs in our community.
Monica, can you clarify how many confirmed cases are in Peoria County?
Of course. So Peoria County has 5 confirmed cases, and Tazewell has 0 confirmed cases, and Woodford has 3 confirmed cases.
Can you explain why maybe it could just be a slow update, but the Illinois Department of Public Health website only shows Peoria at 3 right now?
We actually had a conversation about that with the Illinois Department of Public Health, and it is part of that is a slow update.
And how are the 8 doing? Are they doing okay? Are they recovering at home?
Right now, all of them are recovering at home currently, and I believe one of our earlier cases is about to now be technically outside of that phase and considered recovered.
An Arizona man died after taking chloroquine phosphate. Sorry if I pronounced that incorrectly. His wife is now in the ICU. She says that they took that or decided to take that after hearing President Donald Trump talking about it as something that could possibly cure COVID-19. Are you saying, and this could happen anywhere, it happened in Arizona, but this could have happened anywhere around the country. Are you saying that residents here or anywhere in the state should not listen to President Trump when he talks about things such as this, and they should only go to specific websites for medication or to see what will work?
I think when the question is where really to get key information about medical health information, and I think when it comes to medical information, a healthcare provider is going to be a great resource, as well as those entities that are health-based, such as the Centers for Disease Control and Prevention, or the CDC, as well as the Illinois Department of Public Health website. And of course, your primary care provider or healthcare providers are going to be able to understand that medical information, as well as understanding, again, your own medical history. So as this virus progresses and you are speaking to your healthcare provider, that's a key because they understand your own comorbidity, so what other health issues you have, what other things put you at risk. And that's why the thing we want to stress is while a majority of people will be able to stay at home, self-isolate, take medication, and get better, talking to your healthcare provider or using one of the telehealth is a great resource because to really address your own ideas of what your health status is.
Questions for Dr. Jackson? So can you talk about kind of protocols that the EMS crews are doing if, say, for example, the emergency puts the individual in a spot where they can't necessarily communicate, maybe travel history or contact with someone else?
Sure. In other words, the question being that if the patient is incapacitated in some sort of where they can't answer those questions. If there's still a degree of risk there, in other words, if they're exhibiting signs or symptoms that could potentially be considered consistent with COVID-19, then they are approaching the patient in that fashion. So really, as we see the spread of this disease, some of the travel questions are going to eventually kind of fade away, and we're just going to assume that a lot of these patients that have this, with symptoms consistent with it, we're just going to treat them all the same.
Can you tell me again what you called it? Did you say front door assessment?
Yeah, from the door assessment.
From the door assessment.
Yeah.
Well, and then another question for you, obviously in just our hospitals across the state, concerns about, having the right PPE and everything. Are there any concerns with EMS crews with having that, correct equipment?
Sure, there's always concerns with PPE and having good supplies of PPE, and we are taking steps as a healthcare system to ensure that our EMS crews are being restocked when they come to the hospital with these patients so that they have adequate amounts to respond to the next patient. In addition, there are other stockpiles that have been mobilized to help stock EMS agencies and keep them provided.
Doctor, have you seen increased call volumes in the last few weeks here?
We really have not. If anything, overall, we've seen a decrease in call volume, and I think that's probably reflective of everyone actually following the directive to stay at home. And so in a lot of these situations that we normally would see with a 911 response, people are looking to alternative ways to seek help. So we have seen an average number of cases that would potentially be screened by the 911 center as potential COVID-19 patients, but they have been a handful per day.
Doctor, at the Peoria City Council meeting a few weeks ago, you talked about the 3 different levels that EMS is preparing for right now. What level is Peoria in right now?
We have been at level 2 for the last couple of weeks.
Could you quantify just what level 2 is, what that entails?
Sure. Level 2 was reached, and the decision to move to level 2 was reached when we knew that there were cases in the area. In other words, when we had some confirmed positives within the Tri-County area, we moved up to level 2. What that would entail is that we are going to actually start modifying our responses a little bit with the anticipation that there could be community spread shortly coming. So what that means is that we're going to really start screening these patients more from an EMS perspective, and then really trying to tailor our response to those cases.
And what would level 3 look like?
Level 3 would be if our crews start getting compromised and our response levels start getting compromised, either due to increased call volumes or due to crews being quarantined or out of commission. In that scenario, we're going to start pulling back to some degree on responses and sending single vehicle responses. That way we can still triage, still provide care, and also still provide care to the other EMS calls that we're called to call on. Thank you.
Monica, not sure if you could speak to this, but, you know, we see a lot of diagrams talking about how the test for this, you know, it's not just a simple, you know, cheek swab, it's pretty invasive. If you could kind of describe, you know, what the test involves, so, you know, people may not necessarily think, oh, well, I'll just want to get one just because. How it is something that's invasive.
It is. And actually, Dr. Jackson might be able to better answer it. But right now for the testing, we actually request a nasal swab. So it is a large Q-tip that goes inside of your nose and reaches in there and takes a swab and then gets sent for testing to either a private lab or to the Illinois Department of Public Health labs. And right now, Illinois Department of Public Health labs are going to be those high priority testing. The private labs are still onboarding, but some of them are backlogged. And so, again, prioritized testing will still be at the state lab.
Are you starting to see a faster turnaround on testing in recent days, or is it still about that, what was it, 2 to 3 days for priority and like as many as like 3 to 6 for others?
The question being, having seen a change in the turnover with our lab testing, when the Illinois Department of Public Health set forward new prioritizations for the testing, some that were creating the backlog were moved over to the private labs. So with that, the state labs actually have seen a faster turnaround rate back down to about a day or so. The private labs, some of them have actually stopped collecting samples to kind of catch up on the backlog, making other ones available, and those are starting to actually come online as well. So hopefully, again, I think the governor also mentioned it this past week, we're wanting those commercial labs to be up and running. Having our hospitals get faster access to them is going to be imperative in our response.
I'm sorry, I have one more question for Dr. Jackson. And my apologies if you already said this, but if
No problem.
you did, could you just reiterate for me? In the case that you all go to someone's home, and they're asymptomatic, there are people who don't show signs of COVID-19. What happens then? How do you all minimize risk at that point? Because from the door assessment, you can't visually see that something is wrong with them. So say they did have COVID-19 and now someone from your crew is exposed.
Sure. Obviously, our calls are usually symptom-based, so if somebody's calling with concerns for COVID-19 and they have relayed any of the symptoms that could potentially be indicative of a COVID-19 infection, then our crews are being relayed that information prior to arrival, and when they get there, they have that knowledge. So then they're going to ask some of the questions, and even if historically they have some of those symptoms, then they are putting on the appropriate protective equipment. Okay. Thank you.
One question for Ms. Caroline.
Is Carol still here?
Just one question. You said that with these restrictions, domestic violence is or can increase. Do you have any specific numbers or statistics at this point about how it has, if it has increased in the past week or so?
Not in the past week. We know that during non-pandemic times, that domestic violence happens, 1 in 3 women, 1 in 4 men. A victim happens, 5 victims happen every 15 seconds. So we know that those statistics have probably increased. Our calls to our crisis hotline are steady. They have increased a bit today. We're at about 50% capacity in our shelter. So people are seeking help, but I don't see numbers that are greater than maybe 2 months ago. So we know that there is an increase in domestic violence, and I believe that we are going to see an increase in services, and that's why we want to remain available.
Carol, this situation can seem even more trapped for victims right now.
Sure.
What would you say to somebody who is scared to reach out?
We know that, financial hardships and emotional stress can only exacerbate the cycle of violence. So what I would want someone to know who is a survivor is that we believe you, we care about you, we want you to reach out to the Center for Prevention of Abuse, whether that's through our website, where we have a quick escape, if it's something that you can check out. If you're able to call the crisis hotline. We are going to be there to help you.
Without any other questions, today actually marks 20 days since the Joint Emergency Operations Center has been active for both the city of Peoria and the county of Peoria. This is not a sprint. It's not even a marathon. This is an ultra marathon, so to speak, in terms of a response. To practice what we are advocating, I will be taking a mental health day to ensure that I am a more effective leader for our community and one that our community deserves, as well as a better mom and wife for my family. And so with that, tomorrow's briefing will most likely be led by Dr. Greg Stoner, our medical director for the Peoria City County Health Department. Okay. Thank you. And hope you guys are also taking mental health days as well. You guys are on call.